1. When developing a curriculum for certified nephrology nurse candidates, which strategy best aligns with adult learning principles to foster long-term knowledge retention? A. Emphasizing rote memorization of dialysis protocols. B. Using interactive case studies based on clinical scenarios. C. Providing lengthy lectures without discussion opportunities. D. Assigning extensive reading materials without application exercises. 2. During evaluation of a nephrology nurse's clinical performance, which method ensures the most accurate assessment of competence? A. A self-reported checklist of daily activities. B. An oral exam focused on textbook definitions. C. A direct observation of patient care using a structured rubric. D. A peer discussion on dialysis machine settings. 3. Which instructional technique most effectively addresses the regulatory compliance aspects of nephrology nursing in a training program? A. Role-playing ethical dilemmas regarding HIPAA compliance. B. Memorization of state and federal dialysis regulations. C. Group brainstorming sessions on patient lifestyle counseling. D. Encouraging self-study without guided application. 4. When mentoring a new nephrology nurse, what approach ensures alignment with adult learning principles? A. Dictating strict methods without room for adaptation. B. Encouraging reflection on clinical experiences to build meaning. C. Requiring daily written exams on policies. D. Focusing only on technical dialysis procedures. 5. Which evaluation tool best measures a nurse's ability to integrate patient communication strategies during nephrology care? A. Multiple choice written exam. B. Simulation-based patient interaction assessment. C. Peer feedback form without structure. D. Randomized knowledge quiz on physiology. 6. When teaching fluid balance assessment, which approach most aligns with adult learners' need for relevance? A. Showing abstract mathematical models only. B. Demonstrating how inaccuracies impact dialysis outcomes. C. Presenting isolated facts without patient context. D. Giving handouts without clinical examples. 7. A mentor wants to strengthen critical thinking in a new nephrology nurse. Which question is most effective? A. What is the normal potassium range? B. How might fluid overload manifest in a dialysis patient, and what interventions would you prioritize? C. List 3 causes of kidney failure. D. What is the textbook definition of uremia? 8. Which of the following best illustrates formative evaluation in a nephrology nurse training program? A. Administering a comprehensive certification exam at the end. B. Conducting ongoing feedback sessions during clinical rotations. C. Issuing a single final grade after classroom instruction. D. Requiring only annual performance reviews. 9. When integrating communication skills training, which activity ensures transfer of learning to clinical nephrology practice? A. Silent reading about therapeutic communication. E. Role-playing patient education about dialysis diet restrictions. C. Memorizing a list of patient teaching methods. D. Watching a video without follow-up discussion. 10. In aligning a nephrology nurse training program with regulatory compliance, which element is most critical? A. Ensuring all content reflects current CMS and state regulations. E. Prioritizing general nursing knowledge over specialty regulations. C. Limiting focus to institutional preferences only. Avoiding discussion of compliance to reduce complexity. 11. What is the best mentoring strategy for helping novice nephrology nurses adapt to emotionally complex patient interactions? A. Modeling empathic communication during patient encounters. B. Assigning extra reading on empathy without practice. C. Recommending they avoid emotional discussions with patients. D. Providing only technical dialysis procedure supervision. 12. Which adult learning strategy ensures effective mastery of vascular access management? A. Memorization of procedure steps from a manual. B. Hands-on practice with simulation mannequins and supervised patient care. C. Reading research articles without application. D. Listening to expert lectures without follow-up practice. 13. Which evaluation method most effectively ensures competency in regulatory compliance for dialysis unit safety? A. A knowledge test on infection control policies. B. Observed structured clinical examination, BOSCI, with infection control tasks. C. Peer discussion about safety protocols without criteria. D. Completion of a written reflective essay. 14. What is the primary role of feedback in a certified nephrology nurse mentorship program? A. To correct mistakes immediately without context. B. To reinforce performance with constructive, timely guidance. C. To compare the mentee to other staff without solutions. D. To avoid addressing errors, to build confidence. 15. Which instructional approach supports the adult learner's need for autonomy in nephrology nurse training? A. Allowing learners to select case studies that align with their clinical interests. B. Mandating identical assignments for every learner. C. Requiring passive observation without input. D. Using only standardized textbook examples. 16. When evaluating communication competence in a nephrology nurse, which outcome measure is most reliable? A. Patient satisfaction surveys focused on clarity and empathy. B. Supervisor's informal impression. C. Number of hours spent in communication lectures. D. Quantity of documentation completed. 17. A nephrology nurse educator is designing a curriculum on ethical decision-making in dialysis. Which approach ensures engagement? A. Presenting regulatory codes without discussion. B. Facilitating group analysis of realistic ethical scenarios. C. Assigning silent reading of ethics textbooks. D. Giving a single lecture without interaction. 18. Which mentoring technique fosters professional growth in a nephrology nurse mentee? A. Encouraging reflective journaling on patient care experiences. B. Mandating exact replication of mentor's style. C. Avoiding discussions about challenges. D. Limiting feedback to technical skills only. 19. When measuring a nurse's ability to apply fluid management principles, which evaluation tool is most effective? A. Case-based scenarios requiring individualized dialysis planning. B. Multiple-choice recall tests on fluid levels. C. Peer opinions about the nurse's knowledge. D. Random selection of lab values for identification. 20. Which instructional design principle best supports adult learning in nephrology nurse education? A. Linking new content to the learner's existing clinical experiences. B. Avoiding learner input to maintain strict control. C. Presenting content without relevance to practice. D. Focusing exclusively on theory without application. 21. When a nephrology nurse educator conducts competency checks on hemodialysis machine operation, which evaluation is most valid? A. Direct observation of actual machine setup and troubleshooting. B. Verbal questioning about machine parts. C. Reading comprehension quiz about dialysis manuals. D. Peer evaluation without criteria. 22. Which communication strategy best ensures patient-centered care education for nephrology nurses? A. Active listening combined with culturally sensitive education strategies. B. Delivering standardized scripts regardless of patient needs. C. Using medical jargon extensively. D. Limiting education to written pamphlets. 23. Which mentoring approach prevents burnout in novice nephrology nurses? A. Encouraging work-life balance discussions and stress management strategies. B. Assigning excessive overtime shifts. C. Avoiding personal development conversations. D. Focusing only on skill checklists. 24. A nurse educator wants to evaluate the effectiveness of a new curriculum on dialysis emergency protocols. Which method is best? A. Simulation drills with performance scoring. B. End-of-course satisfaction surveys only. C. A multiple-choice exam on protocol details. D. An unstructured group discussion. 25. Which adult learning approach is most effective in teaching evidence-based nephrology practices? A. Integrating research findings into problem-based learning activities. B. Assigning rote memorization of journal articles. C. Presenting lectures without application exercises. Avoiding discussion of new evidence to reduce confusion. 26. Which evaluation method best captures both knowledge and performance in nephrology nursing? A. Written knowledge test combined with observed clinical skills assessment. B. Peer opinions only. C. Essay writing on patient care theories. D. Attendance records in training sessions. 27. When creating a nephrology nurse training curriculum, what ensures alignment with regulatory compliance standards? A. Including required OSHA and CMS standards in content and assessment. E. Basing training solely on institutional preferences. C. Avoiding compliance content due to complexity. D. Delegating compliance to staff self-study.